All right, Dr. Seegren here, again talking about more coronavirus stuff. Last week or 2 weeks ago, we talked about um, some epidemiology of coronavirus and specifically the reproductive rate, so how fast it spreads. And we learned about how it spreads very quickly, exponentially, and it's pretty hard to control. So it's probably going to be around for a while. And that brings us to today, which is the next really important aspect of understanding this virus, which is, unfortunately, how many people can we expect to die? What is the death rate of the virus? And I've had a lot of questions from you guys about how serious exactly is this disease? Is it really something that we have to be doing all this for and be worrying about? So we'll get right into it. That is what we'll talk about today. Coronavirus pathophysiology. Pathophysiology is roughly means what does the virus actually do to you? So what happens when you get it? Asymptomatic cases, that's this really weird topic right now, which are people that have the virus that aren't showing symptoms. So we'll discuss that, and we really want to know what the death rate of this disease is. And if we understand those things, then it can go a little bit further in terms of understanding what might happen to the world here over the next few months and years. A lot of you are wondering how serious it is. There's a lot of stuff out there right now that this doesn't affect young people, or it's really not much worse than the flu, et cetera, et cetera. I want to bring up New York City and the fact that something like 20,000 plus people have died in the month of April so far in New York City. That is a lot of people. And actually, if you look at the various causes of death over the last month for New York City, the coronavirus, I believe, is the actual leading cause of death in New York City. And that is a pretty massive deviation from the normal in America. And I'll show you this. Causes of death in America typically, as of last year, were number one cause was cardiovascular disease. So I'm kind of putting everything that has to do with heart issues, strokes, diabetes, obesity, all those things I'm kind of lumping together as sort of general heart health issues, cardiovascular disease. They're not all directly related to the heart, but they all have to do with health, eating healthy lifestyle activities and stuff like that. So 48% of Americans that die of one of those categories. Heart attacks, strokes, diabetes, all linked to generally things like overweight, being overweight, having high blood pressure, etc. The next cause of death is cancer, about 33%. Accidents like car accidents and workplace accidents, those things are about 9%. And Alzheimer's, which is a disease for the elderly. And last, there are more causes of death than these things. These are the main five, but you can see only about 3% of people typically die of contagious diseases like the flu or other contagious diseases, tuberculosis, measles, mumps, whatever. So when we're looking at New York City and the last month that more people have died from coronavirus than anything else, that is a big shift from the normal in America, right? That means that there's been a significant increase in the deaths caused by contagious diseases. So we've gone from like 3% up to like 50% in just a month with this virus. Now, that's not true for all of America. That is only true for the kind of center of this current epidemic. So that's pretty shocking, but something I wanted to point out is that this is not all that new for humanity. If we go back to a random year, 100 plus years ago, where there were no pandemics going on or nothing, the leading cause of disease, and I'm just using the year 1900, was actually contagious disease. And the number one cause of disease of death for those diseases was something called tuberculosis. So the world we're kind of living in is a bit shocking that so many people could die from a contagious disease, but it's actually not something that new for humanity. Actually, if you think about it, the vast majority of humanity, going back tens of thousands of years, any given year of that, the majority of deaths would have been caused by contagious diseases. And it's really been only the last 50 to 100 years where we've made medical advancements, things like vaccines, antibiotics, that reduced this number of deaths from contagious diseases. So all that is to say is that if you don't think the coronavirus is very serious, basically it's managed to undo in few places the last 100 plus years of medical advancement and has kind of put us back to a place where nobody alive today has really understood or has known where, leading cause of death could be coronavirus, could be contagious disease. But let's get back to kind of our central question today, which is, what is the death rate of the coronavirus? We know that it spreads really fast and that millions of people have it right now in the world, but our big key on being worried about it is, well, how many people are actually going to die from this thing? Yes, in New York City, a lot of people died, but is that going to be the case everywhere, etc.? That is an incredibly, incredibly hard question to tackle. We'll get into a variety of reasons why that question is so hard to understand right now, but if we had a perfect understanding and had perfect data, the question actually would be very, very easy to answer. The very simple answer of what the death rate is, so how many people we can expect to die from the coronavirus, is simply the number of people that have died divided by the total number of people that got infected. That is the death rate. And the way this death rate number would work is it would be something like 1%. So we could expect if 100 people got infected, one person would die. That would be an example of a death rate. And you can see why that number is really, really important to know. As we're talking about millions and millions of people potentially being infected, what percentage of those people are actually going to get seriously ill and potentially die from this disease? The problem is we could calculate the death rate very easily based on the existing data, but we probably don't know the actual number of people that have died so far. Again, if somebody dies and they've tested positive, then we can determine the cause of death relatively easily. But if somebody has died, maybe not in a hospital or they haven't been tested yet, then healthcare workers and governments are confronted with this idea that, we already don't have enough tests. Are we really going to test somebody, a dead body, essentially, just to add an extra number to the death count? And then, like I said, if we don't have enough test kits for everybody, do you think we're actually counting the total number correctly? All right, so let's say, hypothetically, we do trust the data and we want to calculate the death rate. What are we talking about with the coronavirus? So far, we can go to publicly available information released by governments, and we can check the number of people that have died in the world. Overall is about 200,000 at this point. And the number of people in the United States that have died is over 50,000 at this point. And these graphs are from a couple days ago. Okay, so that's our total number dead if we want to calculate the death rate. If we want to know the number of total cases around the world, so how many total people have been infected so far, right now the world just crossed 3 million when this video, I'm recording this at the moment, and the number of cases in the United States just crossed about 1 million. So let's see, we can just take these numbers and calculate the death rate really quickly. So again, these numbers are a bit old because I made this PowerPoint a few days ago, but at that point in time, 181,000 people dead in the world, 2.5 million were infected. That brings the death rate to 6.99% for the entire world. That seems really high. We will talk about that. And in the United States, something like 45,000 people had died when I made this PowerPoint, and 120,000 people were infected, which brings the death rate in the United States to 5.5%. So what those percentages mean that if 100 people got infected in the world, right now we would expect 7 of them to die. And if 100 people got infected in the United States, something like 5.5 of them on average would die. That is a lot of people. We'll see if we think those are accurate or not, but there are a variety of problems with these sorts of death rate calculations. For one, we already talked about how we're not sure if we've really counted all the people that are dead, and we definitely know we haven't counted all the people that have become infected. So that's going to change these numbers a lot. And then it also, when you do it this way, when you're talking about the total number of people infected in the world right now, when you calculate the death rate this way, you're assuming that none of those infected people are going to die basically tomorrow. So we have to make a distinction with death rate between what we call active cases and closed cases. Active cases are people that have the virus and we don't know what's going to happen to them. They might get sicker, they might die, they might get better. Closed cases would be a person has gotten infected by the virus, but has either died or recovered. There's really 2 options there. If you've recovered, that means you got sick, but you got better. Now you have the antibodies for it. You're immune to it, presumably, and that means it's a closed case. We know you made it. And so usually when you calculate the death rate, you're doing this years after a pandemic or an epidemic, and you're looking at the closed cases, not open cases. So that adds another layer of why we can't trust these numbers. And most importantly here is that we are probably not adequately testing, and we are almost certainly not testing people that might have mild or asymptomatic cases. And to learn about asymptomatic cases and asymptomatic carriers, we get to go have a little bit of a history lesson here. This picture is of a lady named Typhoid Mary, and way back, a long time ago, 100 plus years ago, not sure exactly what time it was, there were some scientists that were randomly discovering that people were dying from something called typhoid sickness or typhoid fever. It was a disease caused by a bacteria. It typically would kill children, and they would, I think it was New York City, they would have all these little clusters that would pop up here and there. And scientists were like, why is this typhoid fever popping up all over New York City in these little clusters here and there? There's no obvious pattern here. And then they figured out actually one person had been to all these locations, this person that we're calling Typhoid Mary. And Typhoid Mary became famous because she is what we call an asymptomatic carrier of the typhoid bacteria. So Mary here, not looking too happy, had the bacteria in her body, and normally this bacteria makes people sick, and then either they get better or they die and they get resolved. Typhoid Mary here, she sort of didn't react normally to this bacteria, and the bacteria could live in her body, and she could spread it to other people, and it would never make her sick, as she never had any symptoms. That's why we call her asymptomatic. A just means without. So asymptomatic means without symptoms. So she had this sickness, but she had no symptoms. And eventually, it's kind of tragic. The scientists told her she worked in like kitchens, and she was kind of like a maid. And they basically told her, "You can't do this job anymore because you're going to get people killed." And she kept ignoring them, and then they would have new outbreaks of typhoid because she just couldn't understand the idea that she had this bacteria that was making people sick. And eventually, I think they had to like lock her away on this island, and she had to spend her last days just looking at New York City from a distance, because she can no longer live as part of society. So that's Typhoid Mary. If you had never heard of that, that was a little history lesson for you. But it seems like something similar is happening with the coronavirus. And I was kind of skeptical of this at first, but now I've seen enough evidence that I think this is an actual thing. The idea that people are getting this virus and are becoming infected and can spread the infection without ever really feeling that sick. So, they don't have a big fever or a big cough or any of that stuff. So maybe very, very mild, like it kind of just feels like you have allergies or something like that. And I'll go over some of the evidence that we have gathered about this, that scientists have gathered on this. But the reason I was skeptical at first, I do want to just briefly discuss, is that when we're talking about somebody who's asymptomatic and an asymptomatic carrier, the assumption there is that they have the virus, they have the infection, and they will never get sick, but they're capable of spreading it. Now scientists are also starting to use the word pre-symptomatic, which means that yes, they have the virus, yes, they're infected with it, yes, they can spread it, and they simply have not gotten sick yet. Another word for that would be the incubation period. And I think we have to be really careful when we're talking about asymptomatic cases that we're not just meaning the people are incubating the virus. So as a reminder, last lecture, we talked about incubation. The idea is that when you first get exposed to a virus and it's the first few days of it being in your body, your immune system doesn't know it's there yet. It hasn't really reacted. You don't have a fever. You don't have a cough. There's not much of an infection yet because the virus is slowly spreading through your body. And we say you're incubating the virus, so it's growing in you, but you aren't yet sick. And pretty much every virus has this incubation time period. And so just because you are incubating the virus and you currently don't have symptoms, so you're technically asymptomatic, you may one day get symptoms. So we just have to be careful. And I know people have been talking about this for a while. One study came out in Washington State where they were monitoring this nursing home, and they did testing on a bunch of people, and they found that like over 50% were asymptomatic. And they thought, wow, that's crazy. Half of these people have the virus and they're not sick. But then they came back a week later, and of that 50% asymptomatic, now almost everybody was sick that had tested positive, like 80 or 90%. So I think we just have to be careful when we're talking about asymptomatic cases that we're not just meaning pre-symptomatic. So are there true asymptomatic cases where the person has the virus for months and never got sick from it and was potentially spreading it? That would be a true asymptomatic case. And recent studies have indicated that yes, there probably are a lot of these cases going around, that these people are not simply pre-symptomatic or incubating the virus, but they're actually true asymptomatic carriers where their infection was just really, really mild and they didn't even know they had the virus and they could have been spreading it. So how do we know this? And I'm kind of glad I held off on making this video for a while because I wanted to verify it. About 2 weeks ago, a study came out in Germany where they were testing people for antibodies of the virus. And as a reminder, things from the last videos are going to constantly come up in the new videos, so we have to kind of be keeping track of all this stuff. Antibodies, as a reminder, are the things that your immune system makes to sort of not directly kill, but basically make the virus inactive in your body. I'll show a little animation of what that looks like. And if you have the antibodies, that is a sign that you have the virus and that you have, if you're not sick, presumably that you have recovered from this viral infection. So all these companies around the world are making these antibody test kits and trying to roll them out in every country, and city is scrambling to try to figure out how many people have the antibodies, because that can tell you the number of total cases that you had in your city, and you can get a better understanding of the pandemic. So antibodies show you that you were exposed to a virus and are likely immune. And the way this works is that you need to prick the blood, you need a blood sample from the person, and then you test the blood for these virus antibodies. And if the test is positive, saying that you have these virus antibodies, then we assume that you were probably something like an asymptomatic carrier for the virus, because if you never got sick enough to go to the hospital and actually get the nose test, then presumably your condition was so mild that you were asymptomatic carrier. Still capable maybe of spreading it, but you never really got that sick. So it was a very mild case. And what the current antibody studies show, and again, there's been one in New York, one in Germany, one in California, I think a couple others here and there, have shown that something like 90 to 95% of coronavirus cases could be these asymptomatic or very mild cases. So that's potentially a very crazy and enormous breakthrough with this disease, if it holds up. And I'll discuss why that would be so crazy. Is that means that 90 to 95% of people with this virus never get sick and never would have gotten tested at the hospital because they never felt sick. And that means that our total number of cases is something like 10 times or 20 times higher than we think it is right now in the world. So right now in the world, we think there's 3 million cases. If 90% are asymptomatic and never get sick, and never got tested, then that would make it more like not 3 million cases, but more like 30 million cases, with the vast majority of those people not even knowing they have it. So on one hand, that's kind of horrifying in terms of tracking the virus. But on the other hand, that means that the vast majority of people seem to be okay with this virus. And the death rate, instead of being like 6%, would be less than 1% maybe in that case. Whew. So that's crazy, and this is all kind of breaking, and I think it's important to kind of be, this sounds like really good news in the sense that fewer people could die and that most people will be immune to this and won't have serious complications to this virus. But it's always important to be skeptical. Most of these antibody studies have not been published yet, so we can't really see the methods that they used, what specific antibody tests they used, how they dealt with what we call false positives and false negatives. A false positive would be somebody who you took their blood, the test read that they had the antibodies and they had the coronavirus, and it turns out that the test is wrong. It was falsely marking them positive, and so they never had the coronavirus, but we're telling them they did. That's a huge deal because we don't want to be telling people the wrong thing. And if you have a small sample that you tested and you have a relatively high false positive rate, you can get kind of funky data. as a result of those two things. Is this potentially happening? Unfortunately, it might be. I was just reading an article the other day that some of the false positive ratios on these antibody tests are like from 1 to 20%. And so that means that, again, we have to see their methods and how they accounted for all this stuff. That maybe all these people that we think were asymptomatic carriers were just false positives on the test. So unfortunately, I wish I had more information on that, but I don't. Right now, I just want to explore the idea that maybe something like 90 or 95% of people are actually asymptomatic, and that seemed a bit weird to me. So let's talk about what happens to people that aren't asymptomatic, people that actually get sick from this virus, what happens to them. And a couple things to understand here is that the virus binds, and we're going to come back to this a few times, something called the ACE receptor in human cells. Actually, the ACE2 receptor. Fix my PowerPoint. And this receptor, remember from the first video lesson here, that virus first has to bind to a cell, and then it kind of puts its DNA in the cell and takes it over. So this is kind of that crucial first step. The receptor that it binds to is this ACE2 receptor. A little bit of molecular biology here for us. And these are really common throughout the body. This receptor is important in regulating your blood pressure. So normally, when a virus isn't binding to it, there's a little protein that binds to it and tells it what to do in terms of regulating the body's blood pressure. And blood pressure is super important for a variety of reasons. And a blood pressure test is the one where they test your arm and all that stuff. So it's really important health. It's a really important receptor to maintaining health. And a whole bunch of them are found in the lungs because there's this massive blood supply to the lungs, and the lungs have to maintain blood pressure very, very evenly. So this virus seems to do really, really well in the lungs because it can bind to that receptor and take over those lung cells. In some people, a bunch of these lung cells are invaded by the virus and are damaged by the virus. So either the lung cell no longer functions properly or it dies, and all of these sort of dead cells build up in your lungs. So you kind of have all this dead tissue, all this dead lung tissue building up in your lungs. And all that is basically providing food for things like bacteria. And so more bacteria start growing in your lungs. And then once your immune system figures out, hey, something really bad is going on here, it starts sending things like fluid and white blood cells to your lungs to try to fight this bacteria virus infection. And all this builds up in your lungs, and that is what we call pneumonia, basically fluid buildup in your lungs. Why is that bad? Well, your lungs need oxygen, right? So they need air. Air comes in your lungs, and your lung cells basically put that oxygen into your bloodstream. If your lung cells are all drowning in a combination of bacteria and dead cells and basically like pus, like white blood cells and all these things that are dying in there, then there can no longer be oxygen put into your blood, and actually your blood oxygen drops way down. Every cell in your body needs oxygen, so as that goes down more and more, things just kind of spin out of control, and that's what people die of, typically. And we would call that respiratory failure. Another way to think about it is you're quite literally drowning in this fluid in your lungs, bacteria, white blood cells, pus, all that stuff. It sounds horrifying. It sounds like an awful, awful, awful way to die. People describe pneumonia like trying to run uphill. And you know how you, like, if you're running uphill, you can't catch your breath. you're just constantly out of breath, like you just cannot get enough oxygen, and then except you're not running uphill, you're just laying in a bed. That's how they describe it, and there's no stopping. You just have to keep running uphill. Awful. And if you've heard the news about ventilators, the idea is that eventually people's lungs just kind of stop working, and doctors have to put them to sleep, put them into a coma with anesthetics, and have a machine that actually breathes for them so that they can keep getting oxygen to their body. So that's what severe cases are of this. So this has been a question that I've been pondering for like months now, is that, okay, so some people, this virus gets into them and it's just devastating and their lungs don't work. They get pneumonia and they die. But the vast majority of people, this virus gets in them and doesn't do anything. How could that possibly be? That doesn't make any sense. And you know, I'm still kind of skeptical that this is actually what's happening, because it just seems like really, you know, hard to imagine that that could happen. And I want to just kind of spell out what we know about this virus so far in terms of these serious cases and these asymptomatic cases and what might be going on. And my initial thought when I was learning all this stuff is that this seems really strange. And then I was sort of wondering, is this really strange? Does this ever happen to any other viruses where most people don't have any sickness and then some handful of people get really, really sick and die? And it does seem to be pretty rare, but not unheard of. And there is one disease that I wanted to kind of look at as an example of one of these weird diseases where vast majority of people have no symptoms. And that disease is something called Japanese encephalitis. It does not only affect Japan, I think that's where it was discovered. It infects pretty much all of Southeast and East Asia. It's a virus that's carried by mosquitoes, and it kills something like 20,000 people a year, which is pretty significant for a virus. And the weird thing is, 99% of people, not only do they not die from the virus, so this 20,000 that have died is actually a really tiny percentage of the total number of people that get infected for this virus. 99% of people have absolutely no symptoms. They don't even know they had the virus. And only 1% have symptoms, and almost all of those symptoms are very, very severe and result in brain damage. So what the heck is happening with this virus, and can it maybe give us some insight into coronavirus, since it seems to have kind of a similar pattern where a lot of people don't get sick at all and some people get really, really, really sick. So what's happening with Japanese encephalitis? I did a bit of research, and encephalitis, first of all, it's a big word, but it just means swelling of the brain. And so almost that 1% of people that have symptoms, it's always basically brain damage. And what happens is that this virus is carried by mosquitoes, and where the mosquito bites you, that's the source of the virus in your body. And the virus can infect a few cells in what's called the lymphatic system, which is kind of like your immune system. And for the vast majority of people, that's as far as it spreads. And if it infects only that lymphatic system, it doesn't really do anything to your body. If the virus happens to catch a ride, either through your bloodstream or through that lymphatic system, to your brain and begins infecting your brain, it kind of spirals out of control. So I guess the receptor the virus needs to really reproduce is in the brain. And once that happens, then you get this fluid rush to the brain swells up, and the virus kills a lot of cells, and people get brain damage, and some 20,000 die. So something like 20% of the 1% die from the virus. So with this particular virus, it's kind of like an all or nothing. If it makes it to the brain, you're kind of screwed. If it doesn't make it to the brain, you don't have any symptoms at all. So could something like that be happening with the coronavirus? Yeah, that is kind of an interesting idea. Maybe if a really big lung infection develops, then people have all these complications. But if it infects another part of your body, then you're okay. That was an idea I was kind of thinking of. Yeah, so with this virus, we say it's respiratory. So most people, the infection starts in your lungs because you're breathing in this virus through somebody else's cough or sneeze. And so that kind of sounds maybe like, no, that's probably not what's happening with the coronavirus. But the coronavirus is also what we call fomite transmitted. So if somebody coughs or sneezes and the virus lands on something like a table or a grocery cart, and somebody else's hand comes along and touches it, and then they wipe their eye, for example, the virus can enter into these other areas of the body, not just the lungs. And so maybe that could kind of partially explain it. If this virus gets into your eye and starts an infection, it doesn't spread very quickly and is mostly harmless. If the virus is established and infects your lungs, then maybe you have bigger symptoms. Basically, all these things that I'm kind of going over today are just sort of hypotheses to try to explain what's happening. And I've done a lot of research, and it seems like nobody really knows what's going on with this virus yet in terms of why some people have such bad reactions and why some people have seemingly no reactions. All right, so could coronavirus have some similar pattern to this other asymptomatic disease, Japanese encephalitis, where maybe it's just a matter of the unlucky people that the virus really gets established in their lungs are the ones that are severe cases and everybody else is fine? It's an interesting idea. I think it may not be true in the slightest. And unfortunately, I just don't really think there's another virus out there that we can compare the coronavirus to. And let me explain why I think no other virus is really like the coronavirus. So if we look at a pie chart here of who is actually infected or affected by the coronavirus, who's actually dying the most, we can see here by the color scheme, our blue color is basically younger people, and actually the 0 to 24 years of age group, you cannot even see. The slice of those age groups that have died of coronavirus is so small that you can actually see it on this pie chart, and we'll talk about that a bit more in a second. And you can see 25 to 44 years, the kind of blue and green on the chart, light green on this chart, is a very, very tiny portion of coronavirus deaths. So 44, 45 years and younger, very rare to find somebody who's died of the coronavirus in that age group. Once you get over 45, we can see that the pieces of the pie start getting really, really big. 90-95% of people that have died from coronavirus are over the age of 45. All right, so that's a little bit peculiar to see this pattern. It would suggest that it's not just a matter if this virus finds its way into the lungs, because why would it not find its way into the lungs of young people? And you might be thinking, well, that's kind of typical of disease in general, that older people are at more risk and are more likely to have severe complications with diseases. To a certain extent, that is true. If we look at the number of flu deaths in the United States by age group, the pie chart looks like this. And we can see it kind of looks similar. Yes, older people do tend to die of the flu more, but our little wedges here of the pie, our little pieces of the pie, now we can actually see the color 0 to 24, and if you notice, the colors for the 25 to 34 and 35 to 44, these kind of light blues and greens are actually also getting bigger. And so far from when I've looked at the data, in the last 2 months, I was just astonished to see that more people have died from the flu that are 25 years and younger than have died of the coronavirus. And the number of coronavirus deaths is way, way higher than the flu, but not for that age group. So it's almost like, and actually looking at the data up until the end of, I think, last week, so I think it was like April 20 something, only 27 people in the United States younger than 25 had died of coronavirus. Out of the 50,000 plus deaths, only 27 were 25 years and younger. Yes, as you get older, the immune system weakens, and we generally do see a pattern with contagious diseases that, the older people get, the more likely they're going to be severe cases. However, the pattern of the flu is, yes, the general pattern is observed, but it's much, much more kind of steep. It's like young people aren't affected at all, and old people are very severely affected, disproportionately so. So what could explain that patterning? And I'm not the only one that's kind of scratching my head on this, especially since with the flu, yeah, young people typically don't die from it, but they still get sick, right? Like I got the flu this year. Maybe there's some variability in terms of, yeah, some people don't get that sick from the flu. But the idea that 95% of people are not getting sick at all from the coronavirus, but as you get into older age groups, then everybody's getting sick and are having really serious cases. Yeah, that's a bit strange for this virus. And what could be happening with that? I find that kind of hard to believe. I've only known kind of one person that I know that's had the coronavirus, and she's in her 30s. And yeah, she did get pretty sick. She had a fever for over a week. And that was kind of my expectation of what it would be like if I got the coronavirus. It would be like a really, really bad flu. But this recent data seems like that, I could have already had coronavirus and not even known it. What's going on with this? It's tough, but actually scientists have been researching this for a while, and as a reminder of that first video, what we are dealing with today is what we call SARS-CoV-2, the SARS coronavirus 2. We just call it the coronavirus, but there was another coronavirus that hit in the early 2000s, I believe, SARS-CoV-1 now that we're calling it, and scientists have been experimenting with it for a while. So it's a similar virus. It's a little bit different, but similar virus to this one. And when they were testing it on mice, they noticed that mice that were like very young, like less than 4 weeks, I believe, for the study that I was reading about, most of the mice, you inject them with the virus, they don't even get sick. They're fine. Very few of them die. And once they get over like 6 months in age, you inject them with the exact same virus, and like 100% of the mice die. And these aren't like super old mice. They're just like a little bit older. And the scientists were like, what in the heck is happening? Why is there this crazy extreme shift in just a matter of a few months for these mice where, the young mice get no symptoms and the virus doesn't affect them and the old mice die? And I was reading all these articles and speculating on it, and the answer is nobody knows, truthfully. I think maybe within several years we might know an answer to that. But We just don't know right now this pattern that's happening, why it's so severe for older people compared to younger people. But that's what we're seeing. And I don't think it can be explained by any other known mechanism of a disease that I know of. Something that is being discussed is it could be a couple things. Yeah, we know older people already have weaker immune systems, slower to respond immune systems. So if you have an infection that starts, the immune system is going to be slower to react. But then also what we're learning more is that there is something called the inflammatory pathway, which is roughly means swelling. So if you get an injury, you notice it will generally swell up over time. Like if you twist your ankle or something, you'll get a swollen ankle. So that pathway is an immune response. Same with things like cuts and everything else. So you get this inflammation. And scientists are learning that older people, their immune system reacts slower to infection, but then when it does react, the inflammation is more extreme than younger people. So it's slower to react and then it overreacts. And when you're talking about inflammation in the lung tissue in particular, it might be that the overreaction and the overinflammation of lung tissue, and remember that means swelling and fluid, may contribute to that pneumonia condition where you're kind of drowning yourself, you're drowning your own lungs in these fluids that are being part of this inflammation pathway. That could be part of it. That's one speculation of what could be happening with these older people and older mice. Another idea was that actually, if we recall, I brought this up for a reason. The coronavirus binds to this thing called the ACE2 receptor in a human cell, and that as you get older, you actually get fewer of these receptors. Now, at first, people were like, well, that should mean the virus is worse at infecting people. But then you have to think about what this receptor normally does. And this receptor, like I said, was really important in maintaining things like blood pressure. And it's also really important in that immune response inflammatory pathway. And so it might be that this virus isn't damaging cells so much as it is disrupting this normal inflammatory pathway and could be blocking this receptor from working and causing this inflammatory response to go out of control in people that don't have enough of these receptors. So these are all ideas. Again, I wanted to discuss them today because I was doing all this research and I thought I'd share it. But ultimately, the patterns that we're seeing with this virus are a bit bizarre, and I still think we just don't really have a grasp of what's going on. I do want to wrap up this conversation about severe cases and deaths, and I do want to bring up one last point here with the death rate of this virus and severe cases, and that is the idea of comorbidities. And comorbidities are basically, the literal translation is co means kind of together, and morbidity means like something that makes it more deadly. So these are characteristics that increase the chance of becoming more deadly. And it can work with any disease really, but with coronavirus, there are certain other diseases that when you combine them with coronavirus, it seems like the likelihood of severe cases are increased. And so some of those characteristics, when we talk about the severe cases, the people that are in the hospital, scientists collect data on them, and they notice that a lot of people that have severe cases have high blood pressure. That might be related something to do with that receptor and how the virus screws up the regulation of your blood pressure. That could be something there. Diabetes, heart disease, cancer, and obesity. Those are all things that increase your likelihood of having severe complications with this virus. 4 of these are really kind of related to each other. Obesity, which means people that are overweight, tend to have issues with their heart and their respiratory tract, which means their lungs as well. So when we talk about things like pneumonia, and I described to you that it gets really, really hard to breathe and get enough oxygen, it kind of feels like running uphill. Well, if you're severely overweight, that becomes much more challenging for your body to deal with. And so things like obesity and diabetes and heart disease are all kind of related to that notion that your lungs and heart are already kind of out of shape and aren't in the best condition. So if we add this extra stress to it, then there's likely to be complications and potentially death. Cancer, generally speaking, that probably has to do with a weakening of the immune system even further. The immune system, of course, is supposed to defend your body from these kind of viruses and bacterial infections. And when you have cancer and you have chemotherapy, which is a treatment for cancer, one of the side effects of that treatment is that it wipes out and can not necessarily completely destroy, but can really reduce your immune system's capacity to fight infections. So all of these things could also partially explain the patterns that we're seeing with the coronavirus, particularly when we think about older people seemingly being more susceptible to this virus. If we look at something like high blood pressure, which is a good indicator for a lot of these other things like diabetes, heart disease, obesity, when we look at that by age group, we see that if you are relatively young, 18 to 40 years of age, you have the percent that have high blood pressure in our population is pretty low. But as you get older, so that would be the light blue would be 18 to 39 in this graph. The darker green color here would be 40 to 59, that kind of middle bar. And you see that middle age group has slightly higher high blood pressure. And then as you get 60 and over, you can see that the percentage of people with high blood pressure really gets really high. And so, as you get older, you tend to have a weaker immune system, but also there tends to be an increase in likelihood of these other comorbidities like high blood pressure, heart disease, cancer, things like that. So that could also partially explain the pattern that we're seeing with the coronavirus severity. And a couple last things to point out here. We started this video today looking at what is the death rate for the entire world and the United States? How does that compare? And all of these factors are going to come into play when you talk about the death rate of any particular country or any particular state or county or city, because the population of that area, the people living there, are really going to be the main determinant of what the death rate in your area will be like. For example, if your area has a lot of old people, then you're going to have a higher death rate. Or if you have higher incidences of obesity, heart disease, diabetes, that kind of stuff, you may have higher death rates in certain areas. And I just want to put up a couple graphs here. These are two countries, the United States and Indonesia. They are third and fourth, I believe, in terms of the global population. So pretty similar population sizes between these two countries. The United States has 328 million total people. Indonesia has 268 million total people. When you look at the coronavirus cases so far, and both of these, countries probably have epidemics going on right now. You could argue that the United States testing is better, and so we have a better understanding of the total number of cases. But when you look at US cases, we have 1 million total cases. So that means at least 1 million people here. The vast majority of those cases will be people that are showing some kind of symptoms and went and got tested. And in Indonesia, you only have 9,000 total cases of people that were sick enough and got tested. Part of that could be testing differences. Indonesia is generally a bit of a poorer country than the United States, So that could account for it partially. But more importantly, I think, is that if you look at the age distribution of these two countries, these two graphs show age distribution. The way you kind of read them, the blue color is male and the pink color is female. And the bottom of the graph, where it says 0 to 4, 5 to 9, 10 to 14, those are different age groups, and the bars represent how many people are in each age group. And you can see that the shape of the curve is kind of similar, except one thing you notice is that there is this big bulge out for the United States for ages, 45, 50 and above, whereas Indonesia, you see that the number of 45, 55, 60, 65-year-olds decreases each as you go up in age. And put simply, that's because older people are dying younger in Indonesia. So you have fewer people reaching an old age in that country. If you have fewer people in those age groups, that means that you have fewer people that are susceptible to this virus, and you're probably going to have fewer people that get sick in the long run from this virus. So part of why the United States has so many sick and so many dead is partially explained because we have, frankly, a lot of old people in our population in the United States. So that's something very important to consider country by country, is that countries that tend to have older populations will have more cases and more deaths than countries that have younger populations. This brings up a big theme in environmental science and socioeconomics, the idea of developing and developed countries. Generally speaking, what we mean by developing and developed, in plain speak, developing countries are kind of poorer countries that their economies are still developing. Developed countries tend to be richer countries. And when you're talking about the age distribution of those two countries, rich versus poor, generally richer countries, because they have more resources and a variety of factors that lead to healthier lives, people live to be older in those countries, and you have older populations. Which means with the coronavirus, as it spreads throughout the world, really, really poor countries, because they have a variety of factors that limit the number of old people in those countries, the coronavirus may not actually impact them as much as they do as the virus impacts richer countries with older populations. So part of the idea of this pandemic and this epidemic, the reproductive rate really explains how many people get infected, but other characteristics of your population can determine how many severe cases and how many deaths you might experience for this country. So we would expect the death rate to be very different between the United States and Indonesia. There have been a lot of news stories that, Africa seems to not have many cases, and I think a lot of people are attributing that to the number of tests available and things like that. That's probably part of it, but part of it may be that Africa's population has fewer older people and more younger people, and the vast majority of the population isn't being affected right now. Although it's still very early to speak like that, but that is possible. And the last thing I wanted to point out when we're comparing different countries and this pandemic globally is those comorbidities as well. So not only does the United States have generally older people, has a more older population than a lot of countries, but also if we look at comorbidities, and the one that's kind of easiest to gather data on is obesity. If you look at obesity by country, we see that the United States is the most out of shape country in the entire world. So when we're looking at this graph, the right has a comparison of male and female, different shades of pink and purple, and on the left, I think, is the average percentage. So this is the percentage of the population that is obese, and you can see at the very top is Japan and Korea. Very few people are obese there, and then at the bottom is the United States. And actually, Indonesia is also right there on the curve there towards the bottom as well. If you compare Indonesia and the United States, just for maintaining the same comparison as the age distribution, we see that 38% of Americans are obese, whereas only 5.7% of Indonesians are obese. And so if people with diabetes, heart disease, these comorbidities, obesity, high blood pressure are more at risk for this virus, then Americans are kind of leading the pack in terms of people that are susceptible to it. And so what we're likely looking at here is that America may have a higher death rate than pretty much the rest of the world because of these factors. And, you know, you can even look at within the United States where are higher populations of older people and people with comorbidities like diabetes and heart disease. And you'll see actually geographically different places, different states in the United States are going to have different death rates and different severity rates of this disease as the virus spreads. So all of those factors are going into this idea of severe cases and deaths. All right, so I realized that video went a little bit longer than the rest of them. There was a lot of information there. And I just wanted to take a moment to summarize everything with my big dog here, Loki. He's been doing well. All right, so coronavirus is a really weird disease, and unlike really any other illness out there in terms of the kind of patterns that we see, it is a deadly disease. Have no doubt about that, no matter what you hear. It's within the last month, it was the leading cause of death in New York City, so clearly it's a deadly disease. But as we learned, potentially there are a lot of people that it doesn't affect. So those would be asymptomatic cases. Typically those are younger people, and this virus seems to affect old people disproportionately compared to other diseases, even when you account for things like weakened immune systems in older people. The patterns that we see with coronavirus are even stronger than that. And in mice, they observed this idea that older mice have way more severe cases compared to younger mice, even if they're all relatively healthy. So there's something else bizarre going on there. And also, people with comorbidities are more susceptible: heart disease, cancer, diabetes, high blood pressure. And those are the patterns we know right now, and we really don't know what exactly it is about this virus that produces these patterns. If we knew more about that, we might have some idea of some sort of medication or cure or treatment for the virus. And that will be the subject of my next video. Are there any ideas for treatments and cures? And we'll explore those in the next one. I think that's about it. What is ultimately the death rate of this virus? After all that, can we even make a prediction of what it is based on these asymptomatic cases and severity in old people and all that stuff? If I were to have to guess, I think the death rate of this virus is coming in somewhere around 1%, probably for the United States. And that is very, very serious. That does not, yeah, it's not as deadly as things like Ebola or SARS-1, but it's still plenty deadly at the rate it's spreading. If it infects a majority of Americans, we would still be talking about hundreds of thousands, if not millions of deaths, just in America alone. So even if the virus is unlikely to affect you because you're younger, doesn't mean that we don't have to be careful with spreading it. And you should still be maintaining the shelter in place and social distancing that you've been following these last few weeks. All right, I think that's about it. Loki, you got anything to add? All right, see you next time.